So for following on from the transplant assessment side of things that I just mentioned, could I ask your perspectives of that process in terms of there must be lots of emotions and lots of concerns during that time?
Yeah, I think for us it was really daunting when we knew that she was up for a liver transplant, but equally almost a bit of a relief that we were there because we'd gone through the past few months of kind of watching her bilirubin going up, knowing she was getting sicker. We knew that it was going to be the inevitable, and so when we got to the point of the assessment, we knew at least things were in motion. So that was actually kind of probably a bit of a relief. It was a very intense week of learning about what will happen during the transplant and what life looks like after the transplant. But equally, Sophie's dad and myself, we quite, like I kind of said earlier, we like being informed, we like knowing things, and I think it made us feel a lot better that there are lots of children actually out. There's been children before Sophie who have been through this process and they have been okay and they're living normal lives now, and you know there are measures in place to help avoid the risks and all that kind of thing. So yes, it was daunting but interesting. I don't know if interesting is the right word, but we just we knew this was what our life was going to look like now. Again, it was out of our control, so we might as well embrace and make the most of it and make the best of it. I think also learning that being a live donor as an option was really helpful, because I think in our heads, you hear about a transplant, being on a transplant list, you need to wait for an available organ to be an appropriate organ to be available. And I know with certain organs you do sit on a list and have to wait, but with the liver we learned that we don't actually have to wait for a deceased liver that's the right size, that's the right plumbing, that fits Sophie, that we can go through a live donor option, and that means that we wouldn't have to do the waiting process as long. So going off of that, can you explain the organ donor process in New Zealand to us?
Of course. So after that transplant assessment and then the baby or the child is then listed, so on the transplant list, there might be 2, there might be 8 children on the list. It varies a lot from time to time. And they're sort of stratified in terms of their clinical priority. So the sickest children will be at the top of the list, and those that can wait a bit longer in terms of how well they are will be towards the lower part of the list. And then, yes, there's 2 ways to get a liver. One is from a deceased donor. And it's not that the deceased donor needs to be the same sex or the same size. But generally, in most cases, the liver needs to be matched by the blood groups. So there needs to be some compatibility. And in some cases, the donor liver will be divided into 2. So the left lobe will go to one recipient and the right lobe to the other recipient. And sometimes it's trimmed down to size or reduced to fit in to a child. So having one lobe, for example, in a smaller child might be just the right size for their abdomen to fit in.
And then what happens to that liver as Sophie grows bigger? Does, what happens if it's a little bit too big, or I guess the question is what happens down the line when it's someone else's liver in her?
Sure. So first of all, maybe I'll answer the other question first. So the other way to get a transplant is from a living donor. And in that case, the donor, it may be a family member, it may be a friend, it may be some other relative, grandparent, for example. In that case, the donor needs to go through an assessment to make sure that their anatomy is okay, that there's no surprises for the surgeons, to make sure that they're not being coerced, that they're making the decision for the right reasons. So that's a an assessment in Auckland as well in terms of a donor assessment. And then the left lobe of the donor is taken and transplanted into the recipient. The liver is very good at regenerating. So even in someone that's had the left lobe donated to someone else, their liver will increase in size over time. Whilst in some cases, in an infant or a child, the liver that they receive might be big initially, and very uncommonly there will be difficulty closing the abdomen for that reason. But usually that improves over a little bit of time, but subsequently the liver continues to grow with the child.
Cool.
So unlike many other organs, or any other organs, the liver is very good at regenerating. And so again, in a child that's 7 months or 8 months that receives the liver, it's not like the liver, if it comes from a 30-year-old, for example, it will then take on the form, if you like, of the age of the recipient.
Wow. That's very cool. Amazing. And then, so once the liver transplant does happen, what does the short and medium term recovery look like? That again, kind of similar to the Kasai question, for those of us who have to travel to Auckland, how long will we be away from home? How long will she have to be monitored closely in that centre before being able to come home?
Sure. So the concerns following a transplant include all the plumbing. So it's connecting the bile, it's connecting the blood vessels, and some of the initial concerns are in terms of how those connections are. The next sort of line of concern is infection. So it's a big operation, there's risk of infection locally or in the wound or whatever. And then there's the further concern is rejection in terms of, so the liver, as mentioned, needs to be matched in terms of blood groups. But there's still a risk of the body rejecting that liver and having an immune response that then attacks the liver. So initially there's a number of medications that we use to protect against infection. There's a number of medications that we use to protect against rejection. And it's following the liver tests, it's following how things are working very closely initially. So initially the baby might be in intensive care for 2 days, 3 days, or it varies a bit. And then on the ward for a period of time. And then usually for at least 6 weeks the baby would be in Auckland because they'll be being seen daily, every second day, progressively less frequently, checking liver tests, checking how the liver's going, checking how everything else is going, and then come back to their home centre. And how long that process depends a little bit about how well things have been, but often babies coming back to Christchurch, like yourselves, might be 6 or 8 weeks, but in some cases that might be 12 weeks in Auckland. So it does depend a little bit upon how things have gone for that child receiving the liver, but also where they live in New Zealand as well.